I'd like to introduce everybody to today's webinar speaker, Jamie Martin. He's the president and CEO of Sigma Med Solutions. Jamie is a GE-trained Six Sigma Black Belt with a diverse background in healthcare and business, including 5 years as an orthopedic surgical consultant, radiology process improvement specialist, business continuance DR solution architect, and founder of an IT services company in Shanghai, China. Jamie founded Sigma Med Solutions in 2006 with partner RHPI to bring high-level Lean Six Sigma training and project mentoring services to small and rural hospitals and community CHCs in a sustainable and affordable manner. Jamie is married with 2 children and resides in Louisville, Colorado. So I will turn it over to you, Jamie, to share your presentation.
Okay, thank you, Leslie, and thank you, everybody, for tuning in today. The topic of the talk today is what we call Lean Sigma Healthcare, and that doesn't exactly sound like the Lean Six Sigma that you know of, and there's a reason for that. Lean Six Sigma is a process improvement methodology that was really developed for manufacturing and other high-volume industries, and includes a number, a vast number of tools and concepts and ideas that really don't belong in a healthcare environment, or that are not that helpful. So what we've done is we've taken a core subset of Lean Six Sigma, teach a few tools and ideas, and team set about on working on projects and making improvements rapidly. And so I wanted to go through our methodology, but also some thoughtware behind the effectiveness of Lean Six Sigma. So real quick, I always like to start with what I want to go over. And the key idea here is that what we're working with is processes, and the way to solve problems within any environment, healthcare especially, is by first looking at the process and not the people as the cause. So 95% of your problems are process related, 5% are staff. Second idea is that to start a Lean Six Sigma transformation effort, you don't need to start big to get big results. The whole idea of training everyone in the facility and starting a whole bunch of lean fires, as we call them, or Lean Six Sigma fires, and seeing what sticks, I think that came from GE and the Jack Welch idea that, hey, you've got to be fully committed as an organization, you got to spend lots of money, and then you'll eventually get returns. But the problem is that in small and rural environments, you don't have that luxury. You don't have necessarily the money, and you don't have the time, or you don't have the people to devote to a Lean Six Sigma effort. So what we have found, and a lot of research backs this up, is that to effectively launch a lean transformation effort, you can start small and make sure that your results on the first projects are meaningfully, and you can grow from there. I'll just roll through these real quickly because I'm going to detail them further in the slides. Another idea is Lean Six Sigma should be revenue positive very quickly. When I was trained at GE, we couldn't start projects that didn't have a highly positive return on investment, and so the thought is that within your facility there are a large number of projects that need addressing and that can become revenue positive in a quick manner, and that will help you build the buy-in internally to stay the course and keep down the path of an eventual lean transformation. I mean, and it just makes sense. I mean, you want to start with the things that are costing you the most money first and knock those off, realize those gains, invest in your future, and then knock off the smaller problems as you go along. A key idea here is Lean Six Sigma tools and techniques are only one small part of implementing a highly effective improvement project. I mean, most people are trained, go to a week-long training course and they learn all the tools and techniques and, hand calculating standard deviation from the norm and things like that, but they come back and they don't have any idea how to select or to run projects. They don't have any idea about change. They may have talked about change lead management, in an hour segment of their course, but they don't really know what that means. And as it turns out, that proves to be one of the most effective or important parts of getting a improvement project to stick. Another point is that changing is about changing organization and people habits. We all operate on habits that we have no idea exist, and we don't think so, but that's really like, I don't know, don't exactly remember the numbers, but it's like 75–80% of all our activities take place outside of our conscious thought just based upon habits. And finally, this is a learning process. The only way to fail is to not start and to not just take that first step forward. People think that Lean Six Sigma is about process perfection and you got to make it 100% accurate, etc. But you get there through an iterative process, and you don't start there. And the only way to not be effective at this is to not take that first step. Okay. So I'm going to start off on a tack that you may not expect. There's a lot of research out there recently, I think, going into the effectiveness of organizational decisions. When it really comes down to it, a Lean Six Sigma project is really just, deciding upon a way to fix a problem and a way to make that change last over time. So what it comes down to is that you need to put some attention into the process of that organizational decision in order for it to be effective. The research is showing that organizational decisions are notoriously ineffective. There's a study by McKinsey that looked at 1,048 organizational decisions, extensive data, analysis, all of, everything you think you need to make a proper decision, yet only 30% of the outcomes were considered effective. That is really startling. And further, you look at corporate mergers. These are the biggest volume, biggest dollar type transactions, and they put so much effort, so much money into making sure that this is going to work for the organization, yet 83% of corporate mergers lose value for shareholders. So the issue here is something's going on in the decision making that is leading to these ineffective decisions, and in your hospital or your organization, I'm certain you can cite many examples of decisions that didn't come out exactly the way that you expected them to. One thing to think about here, 30% of teenagers consider more than one option when making a decision. Only 29% of corporations in the McKinsey study considered more than one option. This led them to the poor decision making, and really, truly, is one way that you can overcome the poor decision making in organizations. What they found in the study was that the decision making process proved to be 6 times more important than analysis in the outcome of the decisions. So what we're putting forward here is that the Lean Six Sigma methodology is actually a way to improve the quality of your organizational decisions. I'll go into a few of the of the reasons for poor organizational decisions. We think we make decisions based upon this rational actor model. You have a choice, you analyze your options, you make a choice, and you live with it. But unfortunately, that isn't the way we do things. They've uncovered really predictable biases in the way that people think and make decisions that are outside of our conscious control or understanding. And I'll just go through these biases real quickly. I mean, you can look into this further. I didn't footnote this, and I should have. It comes from a book called Decisive by Chip and Dan Heath. That's a fantastic look at how to improve the quality of your personal and organizational decisions. But we as people, we only can see what we can see, right? And so narrow framing means that we limit the options to only those things which we see in our spotlight. I mean, you know, imagine your vision is really just a cone straight ahead, and all you see is what's in that cone, just like your car auto lights at night, but you don't see all the other options that are out there. So when you're focusing on that current option, everything else is out of your range, and you don't consider it because you just don't know about it, right? Then when we, as people and really as group leaders, you know, we try to be, you know, balanced and fair and try to gather all the information, but we're only gathering information that has come to mind through really our thinking process, right? And so we typically and frequently gather only information that confirms our already made decision, the option that has come into our narrow frame. Once we make this decision, we're overconfident in our biased conclusions, and there's a whole lot of talk. There's a whole lot of writing about this in the book Decisive. But for instance, you look at Decca Records. They rejected the Beatles early on as really not viable for commercial distribution. That was a big mistake. And then the part that I found surprising, when doctors reckon they're 100% certain of a diagnosis, they're wrong 40% of the time. Now that is really startling, and it comes to the idea that that we are vastly overconfident in our biased conclusions. And then the idea that short-term emotion, heat of the moment, can cause us to go with really not the most rational or logical choice. So how we really make decisions, rather than the rational actor model, is we encounter a choice, but narrow framing makes you miss better options. You analyze your options. Confirmation bias makes you gather self-supporting information. So, of course, your choice is good and rational and well supported by the data, right? You make a choice, but then the short-term emotion is going to cause you to make an incorrect decision, and then you decide to live with it, but you will be overconfident about how the future will unfold, and you'll stick with that decision for way longer than you really ought to. I'll just whip through these real quickly because I'm going to be running out of time here real quickly. This is a topic in and of itself that I would really recommend that you look into. But the way you overcome the biases, and the way that the biases are overcome within a improvement project, within the methodology that is set up for you within Lean Six Sigma, is really reflective of these four. This framework is called RHPI, and it's a framework for overcoming the biases, and it's really well encompassed within the Lean Six Sigma healthcare methodology. So the first thing you do is you widen your options. You look at even one more option, and the effectiveness of your decision is vastly greater. There are organizations in Silicon Valley and they've actually done studies that it makes far more financial sense for them to split up a contract for, let's say, product development among 5 firms and have each firm develop their independent ideas, right? Rather than awarding that $100,000 contract to one firm to design, develop, and build the product. They award the design contract to 5 firms, right? So really only one firm is going to get is going to get the $20,000 to design the ultimately selected product. But they make so much more money based upon the improvement in the decision that this process creates that it makes absolute sense to them. So the whole idea is that when you multi-track, you develop more than one solution to the problem, and you come to a far better conclusion in the end. And by the way, I set up the slides. I put way too many slides in the deck. I'm going to go through what I consider are the very important ones now. I'm going to try to get through most, but if I don't, I tried to make the slides later in the deck sort of self-supporting so that you can go through them on your own and get enough information to help you do some things that you're probably already doing and help you do them a little bit better. So reality test your assumptions, encourage constructive disagreement. That is an absolutely vital element in making a proper decision. You know, the Lean Six Sigma process, team meeting process, is conducive to the whole idea of bringing up all possible options. You know, having the group vote on it and deciding as a consensus what is the best option for the solution to the problem. And it's through that methodology that Lean Six Sigma groups come to better decisions. So the key idea here is that you don't want to stifle disagreement. You want to actually encourage it and explore it and dig into how someone else could have such a vastly different opinion than you, because they're probably just as smart as you, but they're looking at different factors that you have probably not considered in your decision. And so the rest of the RHPI framework, attain distance for deciding, step back and say, hey, what would I do if I were a consultant? Take an outside view, and then prepare to be wrong. You figure out, okay, so I'm sure I'm right on this decision, but what if I'm wrong? I've got to set some framework here that's going to help me from going down that rabbit hole of overconfidence too far. So the real idea here is, as a team leader, you need to consider yourself a decision advisor and recognize that you are subject to those same biases that everyone else is, and that try as you might, you can't overcome them because they're just part of your hard wiring, right? But that by relying on the process, relying on, you know, group multi-voting, group consensus, that you're going to come to a better decision on how to improve things. Okay, so the whole idea here is that better decisions always result when using bargaining, compromise between disagreeing parties. The key here is that through the process, you're building the buy-in of the people who are part of that project, and that's going to spread through the facility. We make up our teams of frontline staff, very few managers. Frontline staff know how to work. They know the problems the customers or patients are encountering. They know how they would solve them. They have an idea of that. Managers and directors and VPs typically don't. So we make our teams very light on them. We trust the people on the front line to help make the right decision about how to improve their work function. And in the process, you get their buy-in. You address what's called procedural justice. When people are called on to when they're asked their opinion, when they're called on to contribute to the solution of a problem, they feel listened to, they feel heard, and even if the decision goes in another direction, they'll understand the reasons typically, and they'll buy into it, and change becomes far more easy when you adhere to the process and rely on that to improve your organizational decisions. So now, finally, what is Lean Six Sigma? I mean, the thing most people think about are the tools and techniques, right? You can go out and you can buy a book on Lean Six Sigma. I mean, we use a text in our courses called Complete Idiot's Guide to Lean Six Sigma, and even in its sort of concise form, it still has dozens and dozens of tools and techniques that are really overload for what you need to do in fixing your facility or your healthcare environment. So the tools and the techniques are only a small part of it. Lean Six Sigma is a rigorous decision-making framework that improves the effectiveness and implementation of organizational decisions. I mean, we talked about that in the decision-making section, and when using the Lean Six Sigma methodology, you can be pretty certain that you're covering all your bases and that your organizational decisions are going to become far more effective. You can think of Lean Six Sigma as a business management philosophy that empowers employees to participate in improving the operational effectiveness of their work functions. You know, people all want to be part of the solution. People don't want to be stuck in dealing with the same complaint over and over and over and dealing with the same problem without having some sort of hand in the solution of that problem. So it's a way to build the connection between employees and the facility, and something that's very, very important in reducing turnover, which is a big problem in all the rural healthcare facilities we work with. And then finally, we can look at Lean Six Sigma as a repeatable project management methodology. It is really a contained methodology. You follow the steps, you fill in the blanks of each of the process steps, and you are very, very, very likely to achieve results that are better than you ever thought were possible. It is truly that powerful. When I was at GE, I felt like this. I learned Six Sigma, and I thought it was just a complete breath of fresh air. Like, this is a way that I can address anything I need to do or any problem I need to solve. It gives me step-by-step process. We all think we're smart, and we all think we can figure things out. We can all do things, but we often miss steps. We skip important ideas, important functions, and the Lean Six Sigma process will give you that framework that will lead you to really effective projects and improvement efforts in a repeatable way. And the key is repeatable. You don't have to get lucky, but you really truly can count on effectiveness every time. And so Lean Sigma Healthcare, I talked about that a little bit earlier. That's what we call the methodology we teach. So we really start with a healthcare-specific subset of Lean Six Sigma. Lean is, if you don't know, Lean is the Toyota production system. We adapt it to healthcare. We use a few of the Lean tools within our methodology, and I'll show you a little bit later how we do that. Lean really focuses on eliminating waste in a process, improving the flow, and through that, enhancing the delivery of value to customers. Six Sigma is the GE and Motorola methodology. That's a new word. That focuses on reducing the variation in processes. When a process doesn't deliver the same output every time, that's called variation. And when that output doesn't meet customer expectations, that's called a defect in the Six Sigma terminology. And so what Six Sigma does is it looks at process design as a way of perfecting the delivery of meeting customer requirements. And so what we add in our Lean Sigma healthcare methodology explicitly is we help you pick the right project at the right time, the right team, and we can give you some guidelines to the team and the project. Don't have time to do that now. And then scoping that project properly is absolutely the key to getting it done and making it effective within a reasonable time frame. Lean Sigma Healthcare adds organizational change leadership. There's some great ideas out there. I'll just touch on them a little bit later that really match up with I don't know if you know of the Cotter principles of change, but within Lean Six Sigma, it really touches on all the Cotter elements of change, along with some of the newer ideas on what's required for effective change. And then process-focused project management is absolutely key. I mean, you can't leave out any of these elements, or else projects are going to founder, they're not going to get done, they're not going to deliver value, or you're going to have the wrong people in the room to solve the problem, or your project's too big and it's never going to get done. So you need to consciously address all of these things. It doesn't have to be through our Lean Sigma healthcare methodology, but by addressing all these things on the front end, then you can greatly increase your chances of project success. So, people think of Lean Six Sigma as improving efficiency and reducing costs and things like that. But when you undertake a project, you don't want to just dabble in Six Sigma. It really truly can be a model for the transformation of the facility. I mean, people don't say, okay, I'm going to spend, $40,000 on a Six Sigma project, and we'll see how that goes, and then we'll go on to the way of doing things. You really want to think of it as part of a process of organizational facility-wide transformation. There are several models for that, and the typical model for Lean Six Sigma is what we call the Big Bang, and this comes from GE. It's a big idea, hire a bunch of consultants, train everyone, start lots of projects, but there are lots of problems with that. Leadership just doesn't have enough time to put the attention to all the projects. And so projects founder and they're not successful and they don't achieve the results that are going to start building the belief within the organization that this is really something to pay attention to. Typically there's a large investment up front with returns, a year or two down the road, and it's a matter of faith. But boards become impatient, CEOs become impatient, CFOs become impatient, and it truly is it's a rare facility that can float through a long-term implementation that costs a whole lot of money up front. The bigger organizations can, and that's what a lot of them do, because they've seen that if you have the financial staying power, that eventually you'll get results. But the problem with the critical access hospitals, community health centers we work with is they don't have the money to invest in that long-term payoff. And then what happens is you fire the consultants and everything drifts back to the way it was before you started. And we just consider that a big waste. A more contained and financially feasible model is to send a person or two, a staff member or two, quality director, performance excellence director, organizational development director to a week of Lean Six Sigma training. They come back with their quote-unquote green belt and they're ready to run projects. But the problem is that this approach rarely is effective because, and I'll tell you, when I first got my green belt at GE, I had no idea what I was doing. I mean, I had a green belt. In fact, then I took the black belt test and I got a black belt. I had no idea how to pick a project or how to. I mean, I knew in theory. So what we find is we go to hospitals all the time. They say, yeah, we sent someone to Chicago for a week of ASQ training. We say, well, how are the projects? Well, they're really, I don't know, they're really just not, they're not making the progress we were hoping. So it's really not an effective, if it's the way that you want to start it, if you have someone who's really motivated, who gets into it and who digs into the methodology, it can be effective. There's a facility here in Colorado, and they trained a super talented and qualified data guy to do that, and he's slowly learning, and he's really making some big improvements. But it's been about a 3-year process since I met him, and he's just now starting to make some big improvements. So you want this to be meaningful and financially relevant quickly, and it's a really hard road when you try it this way. We like to talk about our organic growth model, where you have a big idea, you want to transform your facility, but you start with a small implementation. You pick one meaningful project, make sure it's financially relevant, or regulatory issue you have to solve, or something you've got to get done. You closely mentor it, you watch it, you care, you care and feed it like the seed in the picture. Leadership support, you follow all the steps, and you can really achieve results that you don't expect. The advantages are, and go back here, what happens at that point is you have a really highly effective project, and people start taking notice, and they go, wow, what happened there? How did that get solved? We did a project up in a mountain hospital, and it had to do with assigning of verbal orders. And they've been trying for years to get their doctors to sign the verbal orders. And yet they were still at only 60% compliance, and they were starting to worry about getting dinged for that, and they just couldn't figure out how to solve it. And they had plenty of money, and they figured that this was a real good way to start Lean Six Sigma implementation. So we went in and within about 3 months got their compliance up to, I think it was 85% at discharge and 98% within a week or something like that. And people said, wow, that's amazing. I remember we came in for the meeting with the CEO and some of the board members after the first project was done. They wanted to wait till the first project was done so we could talk about results and start building the buy-in among people who had really downplayed the idea of Lean Six Sigma as being something for their facility. And we came in and the CEO was gushing at how excited he was that this was solved and how this was really the way the hospital was going. And it's that kind of excitement and intensity that you want, intensity of belief that you want to build within your facility with your first project or two. And truly, this is a low risk investment because the first project, the first mentored project is inexpensive. Dollars can be under the radar. If it doesn't work, then you're really not out a whole lot, and you probably made some improvements that are going to get you a return on investment eventually or anyways. In our experience, we've never not succeeded in achieving the goals of the project. I mean, it takes a lot of extra work in some cases, but this is a real good way to start. And we'll go through the methodology that I'm talking about. But the idea is you train teams in the course of doing projects, you mentor team leaders in how to facilitate, how to project manage, where to go when they run into roadblocks, how to do the data analysis, how to present the data, etc. All the things that a black belt or master black belt at a big organization helps green belts with in making projects successful. So we'll talk about that in a little bit. So I'll go through a few examples because, as I said, belief is the key to an effective implementation. And these are some examples, just a few examples of projects we did at critical access hospitals. And it really followed our idea of, look, we want to start with something meaningful, something that will have a financial return, something that hasn't been solvable in the past. Southern Colorado Critical Access Hospital, 40% of all admissions initially had one or more errors, something that required rework. The billing department was spending 40% of their time fixing problems created on the admission. So we pulled together a team. Within about 3 months, the team got that down to, so I'll talk about this later, but we got so when we first started the project, the error rate you could consider as 400 per 1,000. 400 errors per 1,000 admissions, right? That's 40%, right? So following the 3-month project, that error rate was reduced to right around 3, 2, 3, 4 errors per 1,000. And it made a vast difference at the hospital. It was with 3 months, it was the team that did it. We had admissions people, we had registration, we had, I can't think of them, but we had a cross-section of frontline workers who at the end of the project were really psyched about starting another project. And that's the way you want to start this effort. You don't want to start a project that's going to drag on for 6 months, 7 months, 8 months without a whole lot of return, because that is one of the surest ways to kill your idea of a lean transformation. On this project alone, the CEO estimated the return on investment was around 300%, greatly reduced our accounts receivable, which is really the whole goal here. Is we just want to put, and you want to put yourself in a better financial position after a project than before. It doesn't make sense to spend money on solving a problem, spending more money on solving a problem than you're actually going to get in return at the end of the project. And I understand that in healthcare, not all things are money related, but patient safety or compliance type issues that could come back and bite you are equally as important. So those are the kinds of things that you can address with a Lean Sigma healthcare project. Then I'll just go through these pretty quickly. A clinic in on the plains of Colorado, a hospital clinic. They were right about 20%, 25% rework on all of their outpatient service billing orders, and within about 3 months they got that down to 0.6%. And that clinic actually, or the hospital clinic, freed up a couple FTEs. We worked with them on a subsequent project to take the clinic to patient-centered medical home level 2. They used those 2 FTEs from billing and turned them into care managers, and it was all just a really virtuous cycle. And so while you may not want to, while it never is a good idea to use a Lean Six Sigma project to get rid of people or to fire people, you can repurpose people who are just doing non-essential work or work that's been made redundant or unnecessary, and repurpose those into functions that deliver more value for the patient. And then I'll real quickly go through this example because this is a good lead into the first topic in sort of the lean thoughtware section that I'm going to go through. This was a clinic in Casper that was running a deficit. They got a grant to do PCMH, and they wanted us to come in and help them with their PCMH transformation. Well, within about 2 minutes of talking to executives, we realized it didn't matter if they got to PCMH because they were going to be out of business first because they were losing about $265,000 a year. So the staff and execs were talking about, well, we need to market better. We need to go to TRICARE. We need to go to the community college. We need to recruit businesses to bring in their patients or their staff. And we looked at that and said, well, let's go back to step 1 here. Who are your customers? Who are your patients? And what do they want? And how are you delivering on what your patients want? And everybody sat around the room and looked at each other and said, well, that's a good question. And through the process, we figured out that it was really hard for someone who called in to make an appointment. They were often shunted to a voicemail that was never answered. No one even knew the voicemail box access code. And through the process, we were able to show them that they were getting enough calls if they could just turn those into appointments, if they could stop doing telephone medicine with the nurses in the back. Their operation was going to become much more efficient. They were going to see more patients, and they greatly increased their revenue. But it all started with a focus on what was important to the patient. So real quick, before I go on any longer, does anybody have any questions or comments? Okay, I take that as a no. So the whole idea of a process improvement methodology starts with the idea that work is process. Work is process that must create value for the customer, the patient, or whoever we consider our customer within our hospital or facility. Value is something that a customer would pay for. Healthcare processes are typically, and many business processes, business is way ahead of healthcare, and so they've done a much better job of this. But work processes are typically not designed. They just happen. They just are a way of doing things that people think is the best way to do. And it's very frequently not standard. I mean, it's almost always not standard. People just do it, just modify it on a whim. As a result, work processes create a lot of waste. They create a lot of errors. And these errors that don't meet the customer expectations, like we talked about earlier, are called defects. Process problems that create these defects it's called process variation. Anyways, so the whole idea here is that people do a bad job because they're working in a bad process. So when we're talking about a customer, one way to look at that customer is that a customer is a wallet with legs. That customer, the paying customer, can take his money and walk away from your healthcare business if you're not making him or her happy. In rural settings, that's become quite a problem because a lot of people are driving to the city to get their care because they've encountered something at the hospital that interrupted their faith in the hospital, or they were treated improperly, or they just got plain old angry with people. They're walking to the city with their wallet. The way to address that is to focus on what it is that customer, that patient wants. So in improving on processes, the only real reasonable goal for a Lean Six Sigma project is to improve on something that the customer cares about, something that's meaningful to that customer, something that's going to make them happier, and that's going to keep them coming back, that's going to have them telling good stories about the hospital at the cafe. So those are the kinds of things that you need to address your Lean Six Sigma projects to. Now I think I got these two slides out of order. But the key principle that I touched on earlier is that problems are created by the process and not the people. People make mistakes and waste time, but typically those processes weren't designed properly, and the errors are really a result of a lack of good process design. What we find is that 95%, and literally 95% of the time, we can go in and fix a process, and all of a sudden people perform a whole lot better, and people are just, staff members are just amazed. Wow, how did that happen? We were doing a project up at another mountain hospital, and it was this verbal signing of verbal orders compliance project, and the nurses sitting around. There were some ER nurses. There was a hospitalist. There were bunches of people from different functions, and we had the group repeat this. It's the process, not the people. It's the process, not the people. Then the hospitalist was called out, and he had to go see a patient. And immediately after he left, the nurses were saying, "It is the doctors. The doctors are not signing their orders. We don't know how we can make it clear that they need to sign this. We put sticky notes. We do this. We do that. We do this." And they would, we forced them to, but it was very hard for them to repeat, "It's the process, not the people." Well, through the course of the project, what was found was that the nurses were putting sticky notes pretty consistently on the folders that needed signatures, etc. But medical records was coming and taking those folders on a frequent basis and shuttling them down Valley to Glenwood Springs, where they had their billing offices, right? And the doctors didn't even know that those were out there to be signed. If they knew they were out there to be signed, they would have done it, right? So the idea then is that we need to stop pointing fingers at people, and we need to start looking at how we can address errors and mistakes and problems as a process issue. Now, 5% of the people, they're better suited to working down at the automobile dealer or Wendy's or something. But by starting with the perspective that it's the process, not the people, you will make far better progress than if you start pointing fingers and throwing grenades, email bombs and things like that. So what does a bad process do? Waste time, creates defects. We've talked about that. So the net result really is that in business and office operations, healthcare in general, 40 to 70% of what we do is pure waste, right? So if we can eliminate or reduce that waste, we're freeing up resources, we're freeing up money, we're freeing up capital to do the things that we really need to do. Wasted time and defects are just symptoms, so the whole idea of Lean Six Sigma is that we use the methodology to get to the root cause of the problems rather than fixing what we think are the problems, but they turn out to be just symptoms of the problem. So, so the idea then is that before you implement a solution, you want to figure out what the problem is. You really want to get to root cause. So an example here is a patient arrives in the emergency room with shortness of breath. Then the ED physician analyzes the situation, history, exam, blood test, x-rays, and then diagnoses the root cause of the patient's shortness of breath is pneumonia. So brief inpatient stay, antibiotics, and the patient's better. But if we would have treated their symptom, shortness of breath, sent them home with oxygen at night, I don't know that they would have necessarily died, but we would not have addressed the problem, and their pneumonia may have gotten better, or I'm sorry, may have gotten worse. So we need to follow the same process and the same thinking within improvement projects. So really, that's really just a good summary of what we're doing in improvement projects. And we use the Lean and Six Sigma tools to help us get there. Yeah. So, so the idea then, I've already talked about this, getting to root cause. You don't want to patch the symptoms. Patching symptoms really only adds to complexity and creates more errors. So if you don't get to root cause, if you don't solve the problem fundamentally, then you're just making things worse for yourself. Through following the process, using the Lean Sigma Healthcare, Lean Six Sigma tool set as investigative tools to really get to the root of problems, then you can put in place solutions that are far more effective and that are going to last a lot longer. OTIPNI is a really interesting idea, and this is truly the key to getting your processes to operate efficiently. Just teaching people this concept, it helps them make tremendous strides and yields numerous aha moments within group meetings, and I'll explain it here. So all organizations, about 20 to 40% of what any organization does is dedicated to fixing errors that were created by another part of that organization. So in Lean, they call it the fix-it factory, right? So OTIPNI is the principle that's used to eliminate this fix-it factory, and what it boils down to is that each process step needs to know what it means for its output to be on time, in full, and no errors. And to do that, it requires a deeper understanding from each staff member or each process step of what it means for their work to be OTIPNI. And through the process of figuring that out, there's communication, and like I was talking about the aha moments, I don't know how many times I've heard, oh, I didn't know you did it that way, or I didn't know that was causing that problem. So, so the idea of every work process step producing work that is on time and full with no errors is really a key way of looking at how you're going to improve your operations. Within Lean Sigma Healthcare, we set defect goals that are a little bit different than Six Sigma. I don't know if anybody knows what Six Sigma is. Six Sigma is really just a statistical statistical term that references how far from the norm process output is. So Six Sigma is what 3 standard deviations from the norm in terms of process output. 3.4 defects per million opportunities, way too complicated for a healthcare business office process, or most of our healthcare processes. Safety critical processes, yeah, we need to make sure they're perfect and fail safe. But on non-safety critical processes, we set our teams up to shoot for 5 defects per 1,000 opportunities, or really a goal of 4.5 sigma, as something that's attainable, something that's meaningful, and that has a tremendous impact on the efficiency of operations. I mean, think about going from 400 defects per 1,000 down to about 3 defects per 1,000 in that critical access hospital in Colorado. I mean, that people were just, I mean, truly overjoyed at the changes that were happening because of that. So the whole idea is that we're designing we're setting this as our goal, and we reach that goal, and that can be termed project success. If you need to get better, then you can implement another project, but it doesn't make sense to spend the extra money, the extra time that's required to get your processes to perform at a greater than 5 defects per 1,000 opportunities performance level. So it's a realistic target. The theory of constraints is a key principle to maximizing your revenue within a clinic or a hospital. And the whole idea is that every system has a bottleneck, something that slows down the throughput within that system. The idea of, I'm trying to think of where this came from. It was Gold Rat, I think. I think it's Gold Rat. But the whole idea is that saving time anywhere, working on improving, spending money on improving any process anywhere other than a bottleneck will not increase output. In other words, your providers are your bottlenecks within a clinic, right? And patients only go through as fast as the providers can see them, or at least that's the way it should operate, because they are the most expensive resource, right? You don't want your $100, $150 an hour provider, or whatever they're paid. I don't know exactly, but you don't want that $100 an hour provider waiting for something that should have or could have been done by a $18 an hour receptionist. So the whole idea of balancing flow is in allocating resources so that the inexpensive resources provide all of the necessary service or whatever you want to call it to enable that expensive resource to be continually busy and making money for the facility. So we'll step into the project management methodology, the aspect of Lean Sigma Healthcare that I don't know that I'm going to be able to get through all of this. Actually, we're almost out of time. But I wanted to get to this idea that for effective projects, you need to not only think of your tools and your methodology, but you also need to think about change leadership. There are lots of good books on how to do that. Ideas of Cotter. Chip and Dan Heath have a book called Switch that's incredibly incisive. No, I don't know. That's not the right word. That's incredibly insightful in how to lead change, and you have to learn how to facilitate. The project management methodology within Six Sigma is called DMAIC: Define, Measure, Analyze, Improve, Control. And these are the steps that you frame up every project in, and the process that you go through with every project to make sure that on the front end you define the problem properly, that you figure out really that it's worth something. It's something worth solving, something that you can spend money on solving, and to benefit the organization. You measure the current process to really see how you're doing. You're not basing your improvements and your ideas on assumptions about how you're doing. Analyze the current process, improve the current process, and you control the improved process. I mean, really, when you look at this, this is kind of a PDCA, PDSA cycle on steroids, really. The idea then is you really want to spend as much time getting a good project definition, a good project charter as anything, because that'll set you up for success or failure, depending on how well you do it. And then at the end, controlling the improved process is equally important, because if you don't put conscious thought and attention to controlling the process, all the changes that you make will fade away. At this critical access hospital we worked with in Southern Colorado, the CEO said to me, "Well, I really love Lean. We had a Lean project up here one time in medication reconciliation." I said, "Oh, great. Well, how'd it go?" And she said, "Well, you know, I really don't know. It was great at the time, but you know, everybody just seemed to get back to the way they were doing it, you know, and so it had faded, and so that was because they hadn't taken the adequate steps to control the process." So you define, measure, analyze, and then a miracle happens. You define a new process, you improve, and you control. Here's an overview of the project framework and tools. So as we said at the top, you're defining the project through the project charter of Six Sigma, which I thought I might have time to talk about, but I'm not going to. You manage it through the DMAIC process: measure, analyze, improve, control. You understand how it's operating now, and within that understand it column, you have lean tools and concepts. You have fishbone diagrams, process maps, Pareto charts, data, and graphs. So those are the tools that help you understand how your process is currently performing, right? And then you have the third column, designing a new process. You're looking at value stream, you know, resource allocations. You look at potentially lean waste. You look at designing errors out of a process so that it becomes harder to make a mistake than to do it right. I wanted to jump into organizational change management real quickly. This is something you need to put attention to. Research by McKinsey years back said that if you don't put attention to organizational change management, you're going to lose money on anything you try to change. If you put attention and you do the right kinds of thinking and activities around organizational change management, you're actually going to improve and make money on your projects. The power of habit. This really explains why we are so habit-based, and I'll just summarize it by saying that the picture on the left is of a rat's brain the first couple times it goes through a maze. High activity levels throughout. The picture on the right is after it's done it for a couple weeks. And so it walks into the maze, recognizes it, and then see the low energy columns. It triggers a habit, just goes through the habit, then it reaches the end, and the energy spikes. So anyway, that's the way our brain organizes itself to save us energy. If we had to think about everything we have to do, there would just be no way to get through the day. So believe it or not, we're such creatures of habit. We just can't imagine. Human elements of change, I'll leave that to you to go through later. But the key idea I would say is keystone habits. If you pick a right project, not necessarily if you pick a right project, if you do a project, the kinds of things that that are generated within the organization to support that project actually extend the impact of that project far beyond simply the one problem that you're trying to solve. Keystone habits can actually have a hugely disproportionate effect on transforming a facility. So doing an effective, a first meaningful, highly effective project is a really good way to tap into that. So define phase, I'll just go through this. The key is there, it's a project charter. I'd like to emphasize this, a business case, before, and this will probably be where I have to end up this proposal or this presentation. If you put a little bit of attention into figuring out the business case for implementing a project, you will be so far ahead of most projects that are being done in your facility. A business case, I mean, with everything so financially tight right now, facilities just can't afford to spend money or to waste money on fixing things that are important. So if you do this initially, before you get into the project, before you start, you bring people into team meetings, before you start the project, then you will know you're on the right track. A story is we were doing something else in Southern Colorado, and it turned out that the guy said he was a black belt, invited 15 people to our project meeting. I said, hey, look, we typically want 6 to 8 on a team. He said, oh, I want these 15. I've got the project planned, and so we gave him a little bit of rope, and he flew with it a little bit. We went down there, 15 people in the room, and turns out the project he selected was actually a process in the cafeteria that affected 3 inpatients a day, and they were using it as a way to fire the food services manager. Needless to say, the project failed, and he's no longer there, and they really missed an opportunity to make significant improvement. So, Leslie, do you want me to, should I continue? Do people want to just, I can continue. If people want to drop off, that's absolutely fine. How do you want to handle that?
If you want to just quickly go over your process mapping stuff, just for a couple more minutes, that would be great.
Okay. Okay. I'll take a couple minutes here to finish up. But the thing I want to emphasize about measurement is that you all are knee-deep or throat-deep in data, I'm sure. The idea, though, is that much of that data is not useful to you. It's not being used. It's not being used as a way to drive improvement or as a way to determine whether a process is about to start varying from what you want it to do. So we say collect your data with minimum effort, collect as little as possible, but obviously collect enough. Statistical significant amount of data is far less than you actually believe. I would tell a story, but I'm out of time. So you want to make sure that you are smart about collecting data, and that you collect the right kind of data. And that's something that a black belt can help you with. So I'll go quickly. And so I was going to talk about define, measure, and then we'll go a little bit into analyze. This picture is what a typical process map looks like. The problem with this is that it's completely unusable. I mean, it almost tells you nothing, and it just takes hours and hours and hours to do. So what I want to quickly teach you before we leave is our simplified way of doing process mapping. Here's another example. I mean, what do you do with this? It doesn't really mean anything. So the idea of a process map is that you're learning, you're trying to figure out where defects could come into your process or where you're wasting time. Wasted time is very typically a source of errors and a source of tremendous improvement within let's say a clinic. If you look at patient wait times, well, there's a reason why that patient is waiting and not coming in at the, going into the room at the moment he arrives. And often that is illustrative of deep process problems and errors that are occurring in the back. But the idea here is we want a process map to look for root causes on our process maps. So to map a process effectively, what we do is we start with a high-level process. We don't map out every single process step, right? We map out functions. This is how we need to start our project charter with the bounds of the project, the start and the stop. Where does this project or this process start? Where does it stop? And then the high-level process steps are outlined in this manner, all right? And then you want to break down the process into what's going on. And then you want to break down each of these high-level process steps. And typically what you do is you look for the process steps that smell bad, as my partner says, that really just look to be a source of errors. So the point is, you're using group consensus. They know how the process operates to try to uncover these process breakdowns early without having to do a whole lot of measurement first. But you use group consensus to figure out where we could be going wrong, and then you further map that process step into sub-process steps. Okay, we try to keep it simple. Typically what you'll do is you'll pick, all processes have decision points, so you pick the most interesting or the most urgent or the most important process step, the difficult path. And so when you map and fix that difficult path, and you go into detail on that, then you typically solve a whole bunch of other problems within all of those other cases. And if not, what you're doing is you're solving the most important one first, and then you can go through and you can redesign each of those other sub-process steps later. But so the whole idea is we're trying to keep it simple and meaningful for you to do a process map. And then the process map in and of itself, does not provide a whole lot of granularity on what's happening behind the scenes. You can try to get as granular by all these different processes, but it can become confusing. So we use a different way of organizing our process maps, and this is for our drill downs on those process steps, right? I mean, I'll go back here. If you look at the scheduling column there, or actually the pre-admissions testing, each of those is organized, each of those sub-process maps is organized in a swim lane diagram. As you can see, there are lines across the paper that almost look like a pool, and you can see the process steps and the handoffs that occur between the functions and the roles. Each of those lanes is a role. Okay, so in this view, a simplified process map, we have patient, front desk, clerk, and medical assistant. And each of those lanes is the row, and the axis from left to right is time. So within this swim lane diagram, you can see who does what to whom and how they know when to do it. And it's often in this message that's passed between the swim lanes that the breakdowns in processes occur. That's often what happens in hospitals. You know, any problem we're solving involves more than one department. That's because where the breakdown really happens is in this messaging. So swim lane diagram gives you a way to look at this. I was teaching a course in Kansas 2 weeks ago, and so we were doing a rudimentary swim lane diagram of the radiology ordering process, and it just became so apparent to everybody. They said, and so I said, okay, what happens now? Well, the doctor calls in the order, or the medical assistant, or well, sometimes the patient comes in with the order, but sometimes they're referred over the phone. Anyway, so it's just really easy to see how things are not regular and things are not consistent within a process map. And that becomes your insight or your window into the process and how to fix it in the most effective way. So I want to quickly go into improve, because the idea here is that you don't want to